After understanding more about your child's spina bifida diagnosis, what can you do? One of the first people you will meet regarding your child's spina bifida is the neurosurgeon. A neurosurgeon will perform the surgery needed to repair the infant's back soon after birth. They will also do surgeries for shunts or a third ventriculostomy, as well as other potential surgeries depending on your child's needs. Shunts are needed if your child develops hydrocephalus. Hydrocephalus is when fluid collects around the brain, and most babies with spina bifida develop it. A shunt is used to remove the excess fluid from the brain and allow your child's body to absorb it naturally. Hydrocephalus can also be treated without a shunt using a third ventriculostomy procedure. A small opening is created at the bottom of the third ventricle of the brain, which allows excess fluid to exit and decreases the amount of spinal fluid. Before surgery, your child will have an MRI brain scan, and the surgeon will determine which procedure is right for your baby. After your child receives a shunt, it's always good to monitor them and ensure the shunt is functioning properly. If you notice your child having the following, it is possible they may have a blocked or infected shunt, and you should call your doctor. Your child may also develop a Chiari malformation. This is where the brainstem and the cerebellum are pushed down due to less space in the brain. Because the normal flow of fluid is blocked, it can increase pressure on the brain. Your doctor will be looking for this malformation on your fetal ultrasound and MRI. Just because your child has a Chiari malformation does not necessarily mean they'll experience symptoms. You will be asked to watch for these symptoms as your child grows. Because spina bifida can affect the bladder, when your child is born, they will have a catheter inserted, which will continually drain their urine. They will eventually move to intermittent cathing, and most infants do not need a catheter by the time they leave the hospital. Meeting with a urologist will help ensure you know the level of assistance your child needs. Be aware of urinary tract infections. Look out for any of the symptoms below and contact your pediatrician if you suspect one. Almost all children with spina bifida, even those who can walk, have issues with bowel control. This can lead to problems such as constipation, fecal impaction, diarrhea, and urinary tract infections. You can help prevent these problems with proper nutrition and breast milk or formula that best suits your child's needs. Contact your pediatrician if your child has a swollen or bloated belly that is painful to touch, can no longer poop, or is no longer passing gas. Nutrition education counseling is available for families who may need help with these issues. Keep an eye out for diaper rash. Sometimes children with spina bifida need orthopedic care. If your child has clubfoot, hip dislocation, or nerve problems, meeting with an orthopedist can help determine the best solution for their needs. We want your child to grow and develop in all aspects of their life. In order to give them the best chance of success, it's important to have the right team to help them as they grow. Your spina bifida general pediatrician will help you with general spina bifida health problems. A community-based pediatrician will help with routine exams, preventative care, immunizations, and childhood illness. Occupational therapists will evaluate your child's development skills, muscle tone, motor skills, play, and adaptive equipment needs. Physical therapists will work with your child to gain and maintain muscle strength and mobility. This team will monitor and help your child grow, starting from the day they are born. Many early intervention services are offered by local health departments. More information can be found in your Spina Bifida Family Notebook. You can take steps to help your child's development directly by changing play into learning and therapy at home, as well as spending time reading to your child every day. Children with spina bifida are more prone to skin problems due to limited movement, weak muscles, lack of feeling, and poor circulation. It's important to monitor for redness, rubbing, dryness, and need for new devices as your child grows. Your child will likely experience seasonal illness, such as the common cold. Treat these the same as you would treat other children with an illness. Encourage hydration, monitor fevers, and look for any other symptoms you've seen discussed earlier in the video. If you are ever concerned about illness, contact your pediatric provider. It's recommended that children with spina bifida receive all vaccinations recommended by the CDC. Children with spina bifida have a higher likelihood of latex allergies. We encourage parents to avoid exposing their children to latex, and our staff will take the same precautions when working with your child. So where can you turn for more help? Your Spina Bifida Family Notebook, as well as the Spina Bifida Clinic, the Spina Bifida Association website, and local support groups such as the Intermountain Spina Bifida Support Group and Facebook Spina Bifida Family Support Groups.